So welcome to Medical Mondays with Dr. O. We're back again for another beautiful session. And I hope you all had a beautiful Labor Day. I did. I had an amazing time at my niece's wedding. And so I thought it was nice that we took off to celebrate Labor Day. So Dr. Opesanmi, a family practitioner, HIV specialist, and I treat addictions in Maryland. I enjoy sessions that we do here, medical missions, and just disseminating correct, congent medical information. Tonight, we're going to be talking again about what we think is women's health, right? But really, it's all of our health. Without conversations like this that we're going to have tonight, there will be no procreation for some, maybe for most, because we're seeing a lot of problems than we've ever seen in our generations. So we are grateful to be blessed by Dr. Oluyemisi Famuyiwa, who is one of our best in the state of Maryland in infertility medicine. And what a gem. I'm going to hand over to her to talk to us about, you want to get pregnant? What about the egg quality? What about it? The floor is yours, Dr. Famuyiwa. Welcome.
Good evening. Thank you so much. I really enjoy coming to this forum, and I love the back and forth. It's really wonderful. I'm going to try and share my slide. Okay, share. Can you see my slide? Is this visible? Dr.
Yes.
Okay.
Yes, it is.
Yes, it is.
All right. So we'll get started. And today, the topic about quality of egg or sperm is really a lot. So what we're doing is just breaking it down a little bit tonight. And we go back and forth between talking about the egg quality as well as the sperm quality. And we'll talk more about the sperm at a later date. So today I wanted to focus on egg quality. So we'll talk about how egg quality affects fertility. How does it affect what the yield you get? Okay, so let me go here. How do let me see. Okay, so I'll go to my next step. When we refer to egg quality, we're actually referring to the ability of the egg to be fertilized and to yield a viable embryo that has a reasonable chance of actually implanting into the embryo and developing at term. So it sounds very simple, but for you to have a baby at the end of the road, you have to start all the way back at the level of the eggs. Let's look at the building block of the eggs. The most important factor in the egg is actually the DNA inside the egg. And I've put this slide up to show you how important it is to have a capable DNA coming from both the mother as well as the father. What happens is the DNA of the sperm and the egg has to be reduced from its 46 chromosome, what would I say, the 46 chromosomes that you have in an adult woman or adult man. That has to be torn down to 23 chromosomes in an egg, and that fertilizes with another sperm that has 23 chromosomes, and you yield a normal embryo, okay? And that's what this is describing in terms of the egg being fertilized with sperm to yield a normal embryo. Well, how does that happen? You have to go to the level of the DNA. What happens is, in an egg, the chromosome of the egg has to be separated down. So you have your chromosome from the egg being pulled apart, so you have one unit of DNA in the egg. It has to be reduced to this level in order to combine with the DNA of the sperm. Okay, so how does that happen? The biggest thing is when you are getting the egg ready and prepared to be fertilized, it takes a lot of energy to move the DNA to where you need it so that it can actually be fertilized. Part of the problem that decreases the quality of the egg is if you have anything that decreases the ability or decreases the production of energy that's needed to actually result in the division of the egg. Let me show you this little movie. I think I've shown you before. I think it goes by very, very fast. So I'm going to go one more time, and I'll try to stop it where I'm, okay, start it. Okay. When the egg is ready to start being divided, the DNA within the egg has to line up along the pole in the nucleus. Then you have a center at each pole that will now generate what is called a microtubule. This center here requires a lot of energy to generate. Think of it as a pulley rope that goes to the DNA in the middle of the cell and pulls it apart. You need an incredible amount of energy. That energy is found in what is called the mitochondria. We have found out what happens as a woman gets older. First off, you do decrease the quantity of eggs you have, but the competency of those eggs go down. The problem is, as you are exposed to environmental toxins, or maybe in some cases, maybe genetic, you may encounter things that decrease the ability of the mitochondria to release that burst of energy to pull the DNA apart. All right. Most of the things that hinder this separation has to do with anything that would increase inflammation in the body. And I'm going to go into that later. So for this to happen, and of course, this, has been sped up, but it happens fairly rapidly in cell division. You need a lot of energy to separate that DNA from 46 to 23. And then you see now it separates again. So you get 4 sister chromatids from each one division. All right. So bear this in mind as we talk about potential things that could disrupt this. Okay. So a lot of energy is being used up even before you get to where you can even fertilize the egg. Now, when you fertilize the egg, the DNA that was pulled apart for a reason, it's reduced in a process called meiosis, has to be paired up with a comparable chromosome from the sperm. And then they replicate, they double, and they also shuffle each other up so that you come out with a totally different combination of DNA than you started with. And that's why 2 siblings cannot be 100% alike. And once that process takes place, the resulting embryo undergoes its own rapid division as well, right? So it immediately starts to divide first into 2 cells, then into 4 cells, then 8 cells, then a rapid division to where it becomes what we call the blastocyst, where the cells that will form the baby are populated at the bottom, and the parts that will form the placenta or afterbirth surrounds the baby in this ring-like fashion called the blastocyst. So you see there's a lot of energy being expended, a lot of division going on. There are a lot of things that could yield problems when this whole, think of it as a perfectly choreographed ballet dance takes place. If you introduce an insult during this phase of development, you are going to have abnormal genes resulting in the embryo that may either A, not implant in the mother's womb, B, implant and stop growing, you have a miscarriage, C, implant and be genetically abnormal, you have an abnormal fetus, some of which may survive, some are not compatible with life, and so on and so forth. So I just showed you 2 rapid choreographed sequence of events that takes place before you even get to where you're going to see the embryo. Now, what can you do to aid this whole sequence of events? Keep in mind that, and I digress, I apologize, I was making slides up until a few hours ago, so some of the things I'm going to talk about are not in my slides, and I hope that gives us room for further discussion at another meeting. But you see, I showed you how the DNA is separated. You need a burst of energy to do this, and then you partner with the sperm, and then rapid division goes on. If you have a highly inflammatory environment, this whole process is thrown off track, right? And can even yield to people having recurrent pregnancy losses. So the most common thing that causes this, and the most common abnormality you have is in the chromosome, which I showed you, and I showed you why, is if you have an insult at an early phase of this, what are the potential insults? Let me turn my AC up a little bit. Things like contaminants in your environment. And I know that we've discussed this ad nauseum in this forum, but most people don't know things like BPA, your bisphenols, your phthalates. They can act as endocrine disruptors. So they disrupt the brain's ability to choreograph this event by interfering with the hormones needed for some of this activity. Where do you get some of those things? If you eat hot food made or prepared in a plastic container, you will leach off phthalates into your diet that can have this effect. And indeed, there are studies that showed that women who have a higher level of phthalates in them have a higher incidence of miscarriage and also have a higher incidence of infertility. So try to eliminate, you're not going to perfectly eliminate it because it's everywhere. What you can do is try to reduce the highest culprits. And you can easily research products that have phthalates and BPA and try to avoid some of them. But what most people don't know, things like perfume, deodorants, lotion, makeup, nail polish, some of these have a higher than other events. So you can actively look for products that have lower levels, and they may be advertised as such. Now, some of the things advertised as that are really truly not that free. So you really have to do your homework and know where you're getting things from. I know that I think Whole Foods, they sell deodorants and some of their antiperspirants with low BPA, or they try to make sure it's organic in that event. But be careful of that. Now, if you have a high level of this phthalates or whatever, there are some supplements that may negate some of these effects. And I want to talk a little bit about some of the supplements that you can use. Now, having said this, I don't want everybody to go crunch everything on this list. If you're taking 2 to 3 supplements, they're called antioxidants, that's probably fine. Because I'll hopefully mention some that are harmful that you don't want to ingest. Vitamin D, we talked about that. That's the vitamin of life, isn't it? We now know that it's critical in that process you saw just now. And it also works as an antioxidant. Most people are vitamin deficient. So you might be interested in having your doctor check your vitamin D level, because you may need to supplement it or may need to initially boost it up with a high dose and then maintain a higher dose of vitamin D to keep you at that level. I recommend a prenatal vitamin formulation that has, for younger women, it has 2,000 of vitamin D in it. And for women older than 35, it actually bumps it up to 3,000. Folic acid. The key thing with folic acid is it's very difficult to see folic acid in the right amount in your over-the-counter preparations, right? So you might see some vitamins that claim to be the best, but they only have like 400 of folic acid. That's not enough. That's just not enough. An adequate amount should be about 1,000 folic acid. And also, you might want to check that you have the folic acid in the bioavailable form. The bioavailable form of folic acid is methylfolate, right? There are some people that have genetic mutations where they cannot convert some of the commercially available folic acid to the bioavailable form. You can easily get this checked out if you want. Ask your doctor to run a genetic test, or simply just take a brand that has the bioavailable form. So the brand I recommend has the bioavailable form. The only time you worry about it is if you are intolerant of the bioavailable form, you might want to take a lower dose. Vitamin B12 is another antioxidant that may help in reducing what we call oxidative stress. What is oxidative stress? In the process of carrying out its business, your machinery that releases energy in the cells is going to give off what we call free radicals. And you need something to sponge up these free radicals so they don't cause damage within the DNA as it's moving around doing its job. All these supplements are labeled antioxidants, and they help to reduce the oxidative stress. For some older women, I might add melatonin at night, because melatonin and DHEA in older women who have a low ovarian reserve may actually help to, it acts as an antioxidant. One thing that I do recommend for women over the age of 35 and women who have a low ovarian reserve, even if they're younger, is CoQ10. And I think we've talked a lot about CoQ10 in this formula. It's a great antioxidant, but you have to be careful that you also are taking it in a form in which it can be absorbed. The brand I use has a polymer form that makes it readily available to the system. So it has been linked to improving egg quality. Other things you can use include L-acetylcysteine. Again, this works at the level of glutathione, but like I said, you don't need to take everything on this list. There are some places where they've given women with recurrent pregnancy losses, L-acetylcysteine and alpha lipoic acid that are both antioxidants. And the same inflammatory process that we talked about, decreasing egg quality, may also be associated with patients who have recurrent pregnancy loss. So if all else fails, you can add it to these patients. One of the things that I'll point out, hopefully we'll get to it, is a lot of these supplements and coenzymes, you can actually also get it in your food. I like to eat my vitamins, as I say, and we'll talk about some of the things that I share with my patients. Let's see. Vitamin E, we talked about myo-inositol. Myo-inositol is helpful. It helps in the glucose pathway. It's helpful in patients who have PCO patients, PCO, polycystic ovary syndrome. So in my PCO patients, I'll supplement them with myo-inositol as well as the core vitamin I use. DHEA I give in my older patients who have diminished ovarian reserve. All right, so one of the things I give my patients and that come in is I talk about what can you do to prepare your body. Now, the thing about your eggs is the egg that you ovulate in 1 month is actually pre-selected and has started growing 2 or 3 months down the line. So if you want to influence your eggs, and say you want to get pregnant by Christmas, then you want to start watching what you put in your body, what supplements you give your body, what you do with your body 6 to 8 weeks before the time that you intend. You want to boost the quality of those eggs by decreasing the toxins I talked about, by taking some supplements that might help you, and also what you eat. So again, this has been talked ad nauseum. These are the kind of diets that will decrease inflammation, right? Think decrease inflammation as a systemic effect. By the way, I like to think that when you decrease your overall inflammation, you live longer anyway. You have a lower risk of heart problems, you have a lower risk of dementia, your brain functions better, your eggs and your sperm will love it for it. Avoid trans fat. One of the tricky things I like to say is if it's solid at room temperature, well, it doesn't take rocket science to see what it's doing to your body, right? So avoid trans fat. You want to you look at the oils that you use in cooking. Olive oil has been shown to be very good. And if you like to heat your stuff, like I like to air fry my plantains, I use avocado oil because it doesn't break down under heat. Choose the carbohydrates that will break down slowly, right? Your local yams, African yams will do that. Rice, it's going to break down right away and spike your glucose in no time. So you probably want to cut down that rice, bread, pasta, and choose your slow carbs instead. Look at the kinds of vegetables you're eating, gives you extra iron. I always say, drink to your health. I love water. And I'm on a sparkling mineral water binge right now. So I tell my people, if you don't like the taste of regular water, go with sparkling water. And I put a plug in for Costco. I think they have the best tasting sparkling water, and it's in a can. Check your weight. It's very, very difficult to get pregnant if you're out of what we call the fertility zone. So I have some patients who have a BMI, in excess of 40. Yes, we can get them pregnant, but it's a little harder. So I try to work with them with trying to decrease that BMI, because sometimes they just don't respond, or if they respond, they have more complications. And then the following is just a I won't bore you too much with it. I'll fly through it. These are part of the list I give my patients. It doesn't tell them you have to eat this. It just tells them what kinds of food will have what kind of nutrients in it. And you can see what if you like, if you don't like oranges, well, kiwis are very good with vitamin C, or strawberry. Make sure you're eating organic strawberry, because they are one of the dirty fruits out there that soak up a lot of pesticides and insecticides. Oh, I'm sorry you can't see this. We just talked about plant-based proteins. I think you guys have talked about this ad nauseum. I love nuts, and I love lentils and beans, but it's a plant-based protein. It's rich, it's good, tasty. Eggs, what can eggs do for you? I don't eat eggs that much anyway, but if you do eat eggs, it is high in the B complex vitamins that are important. It also has choline for fetal growth. The vitamin that I recommend for my patients actually has choline in it. So, if you don't like eggs, if you take the Theralogix brand of vitamins, you'll get this supplemented. And eggs also are rich in biotin, folate, B12, if you want the natural. What is tomatoes good for? High in lycopene, which is very good for, it helps with sperm motility. Make sure it's not contaminated with your pesticides, because it can be. Yogurt, if you are not allergic to dairy, can help improve your biome, has high zinc, which is also an antioxidant. So if you like me, you don't like to take zinc as a supplement, then do yogurt. I love yogurt with some granola mixed in there. You get your zinc supplementation. Berries, I love berries. They have just very rich in antioxidants. The more color you have in your fruits and vegetables, the more antioxidants you're going to have. So if you do the color match, you just put a whole rainbow of color on your plate, I think you will be covering a lot. So I have come to the end of my slide. I'm sorry I talked too long, and I will entertain questions.
Thank you so very much. And no, you did not talk too long. Oh my gosh, that was amazing.
Thank you.
Amazing. It goes beyond the quality of eggs and, getting the body ready for pregnancy. This talks about prevention of disease entities, even prevention of cancer, things you mentioned.
Yes.
But I'm going to have others ask questions before me. I think, Auntie Tawa, you have your hand raised, ma. I'll reserve my questions for now. Go ahead, ma.
Good evening, everyone. Good evening, Dr. Famuyiwa. Thank you for the information.
Yes.
It's a wonderful information and very loaded. But all the time you are talking about the ova. What about the sperm? It takes two to tango.
Absolutely. Because as I said, I don't know if you were here when we start. I told Dr. O that, maybe we should, because I think that would be a whole lecture by itself. Because if we try to talk about both, I don't know that we'll get in much depth. But you're right, it's very important. And, we will talk about that. Now, by the way, a lot of the things that help improve egg quality will also help improve sperm quality, right? But there are other things you can do for the sperm as well. But bear in mind, there are a lot of things that, because basically what it is you're trying to live your healthiest life possible. I mean, shoot, who doesn't want to live to be like Queen Elizabeth and die at over 96? I mean, I'm aiming for 100. I don't know about you guys. but we're talking about things that you can do and implement that will hopefully get you there.
Thank you.
Thank you.
Thank you so much. That was an excellent question. And yes, and an excellent answer, because I mean, these are loaded information. I have questions.
Yes, ma'am.
Or, input, the plastics.
Yeah.
You know, we've heard a lot about plastics on this platform.
Correct.
We learned also that when you cook your food, you should not, when it's still hot, don't put it in plastic because the phthalates would seep into it.
Yeah.
We learned that put it in a glass container, let it cool, put it, and let it even get cold in the refrigerator if you want, if you have to freeze it in plastic before you put it in the plastic. I came to the conclusion that I need to get rid of all the plastics in my home. That's what I need to do so that we don't need to worry about it. So you mentioned today that these phthalates are in cosmetics.
Yes.
Also, can you say some more about that?
Yes. You know, you have to be careful. Most cosmetics don't put the ingredients in there, right? But if you start doing your homework and digging a little deep, you can come up with which ones are loaded with some of these chemicals that are actually toxic to your body. So you know, just as much as you eat organic food, maybe you should be looking at organic makeup, organic lotions, deodorants. I mean, when I read and found out more about this, I changed my deodorant. I use one that's, it's based on oats and it's natural based and it works. So without feeling like I'm putting toxins in my body. Now, another thing that is concerning is you can get phthalates on paper receipts, you know, the thermal receipts you get when you go to the grocery store. So when you get home, wash your hands, Because if you've dealt with, you know, paper receipts and stuff, you will have some on your hands. One of the things I read was it could also be present in, you can have phthalates in the laundry, what do you call it? The laundry,
detergent.
yeah, your laundry, what you call it, can give you phthalates. So you have to look at your, or what the, for softeners, your softener, your, what do you,
Those paper softeners that you put in the dryers,
Drying
yes,
sheets.
the
exactly,
drying sheets,
exactly,
they
exactly.
have phthalates.
Yes, they do. They do. They do. So you want to be careful with that. They do have phthalates in them.
And you said receipts from the stores also.
Correct, correct.
Wow.
Because those have thermal, the thermal paper that you use, those have high phthalate content in there. Yeah.
Interesting. So this goes beyond just eggs because this is a carcinogenic
Correct.
substance, cancer causing.
I think that, you know, a lot of people, especially I think in the Nigerian community, I think people are used to cooking and warming stuff with plastic. You know, they don't think anything of microwaving their rice or fufu in a plastic bowl, right? You just wonder how much of the plastic is going into their system when they microwave it. It's almost like a double whammy on your system, but a lot of people consume plastics. And there are now, if you go to a functional medicine person, they can do tests where they can find out what are all the toxins in your body. And you might be surprised how much microplastics are in your system. You know, I think that most people, if they knew, they would be shocked, you know. So try to avoid plastics. Another thing I was reading, if you prepare hot tea, well, don't drink tea or coffee if you're trying to improve your egg. Caffeine is not good for you. But if you have a machine that has a lot of plastic parts, if you do, you can have increased plastic leaching off and phthalates from that.
Interesting.
Yes.
So, Dr. Binwu has her hand raised. Please unmute yourself.
Thank you.
There you go.
I got one question. I think, how about the patient just take the multivitamin? That's enough, or need separate for the multivitamin?
So vitamins,
Yeah, I saw you give a lot of folate. So how can people get the supplement? They just take one multivitamin. That's enough.
well, see, but the multivitamins in a regular, the ingredients in a regular multivitamin capsule is not enough for people trying to get pregnant, right? So
Wow.
for people who are trying to get pregnant or obstetrical patients, you need a higher dose of vitamin D, and you need a higher dose
Oh,
of folic acid. So the regular vitamin D or the folic acid is not enough. It's not enough.
oh. So the melatonin also
Yeah.
is good to take for people.
Yes. So melatonin is good if you're trying to get pregnant, because melatonin
Wow.
acts as an antioxidant as well, right? So all
Yeah.
things reduce that oxidative stress, reduces
Oh,
inflammation in your body. Anything we're talking about decreases inflammation. All these
okay.
supplements I told you decreases inflammation. There are some supplements out there that people are using incorrectly. I didn't get to put this on the slide, but there are some people who use something called a piclogenil. It's not naturally made in humans. There are no studies involving human eggs, so I would not recommend it. There's another supplement called Royal Jelly that is produced by bees, mainly for the queen bees. It's not naturally made in the human body, so it's not something that you should do. L-arginine is not also something that you should ingest. It can be harmful to your eggs, so you want to avoid them as well.
If another question is, if a patient eats enough the vegetable, green leaf vegetable, do they need to take the supplement?
So it depends on, well, we definitely recommend vitamin D. I don't know that you can consume enough of it or expose yourself to enough sun. So I think most people do need vitamin supplementation. You do need to check your vitamin D levels, right? So you need to supplement with vitamin D. It's not even enough if you look at it that way.
Thank you.
Yes.
Thank you.
Yeah, thank you so much. And that is so true. And there isn't enough vitamin D in milk, as people believe. You can't get your vitamin D from milk.
Yeah.
Just supplement.
Exactly.
We also recommend that you don't stay in the sun without sunscreen because of cancer.
Correct.
And so going to lie down in the sun is not what we will recommend as a source of you getting your vitamin D. And things that are high in vitamin D: tuna, mackerel, salmon. Dr. Jagbe sent me something about fishes, the mercury level in fishes a few days ago, and we will talk about that sometime on Medical Mondays.
Correct.
I was like, whoa, I think it's important to know, the mercury levels, and even without that.
Correct. Like when I do have a brochure I give to my patients listing the types of food. I borrowed some of it for the slides I gave you.
Wow.
I do specifically point out that they have to be careful with things like tuna, because tuna is one of the culprits that have a high mercury level. So you want to go with fish like, wax, salmon, snapper. So there are other you can besides tuna.
Yeah. Thank you so much. That is important. I think something disturbed you a little bit there, that you have to be careful about tuna. Yeah, because of the high mercury level. Thank you so much, Dr. Jagbe. Sir, you can unmute, sir. So ask your question.
Thank you, Dr. Famuyiwa. I know you mentioned something about hormones.
Correct.
You talk a little bit about prolactin level as it affects the quality of eggs.
Well, the first thing with prolactin is not just affecting the eggs. It can also disrupt your menstrual cycle. So it can affect ovulation. So it does disrupt ovulation. So you want to, I usually check prolactin levels, especially in patients who have irregular menstrual cycles. You want to know, one of the reasons they may have irregular cycles is because they have a high pituitary level that could be from, it could be from a pituitary adenoma. So those are the things we check. I usually screen my patients for prolactin level. I know I didn't mention it, but it's really important as well, is to make sure the first thing you want to do is go get a dental checkup when you are trying to get pregnant. So again, you want to decrease inflammation, right? You want to decrease inflammation because excess inflammation can decrease fertilization and egg quality as well.
Thank you.
Thank you so much. And melatonin, I almost forgot that I wanted to say something. Then I saw Dr. Ajagbe's hand. Sleep is very important in life. Another thing melatonin would do is it helps you sleep. That rest is very important. And wait, oh my gosh, you mentioned something about insulin, in one of those slides. And you talked about weight, about the BMI, that is the height compared to the weight, what it should be. Normal should be 19 to 24. 19 to 24, the BMI, when you compare your height to your weight. So when people have weight, then they have a problem with, insulin doing what it's supposed to do, where it's supposed to do it. And so the sugar goes up, and that affects pregnancy as a whole. Or is it the egg it affects? Is my question.
It does affect fertilization. You have too much sugar. And also remember, sugar is also a highly inflammatory substance. The more you have high sugar levels, the more you're going to have an inflammatory state. So overall, just bad news for the egg quality and also your lifestyle as well.
So talking of lifestyle, I have a question. Is it okay for a pregnant woman to exercise?
So what we normally advise women is if you've been exercising since before you got pregnant, you probably are okay because that's something you've been doing all along, right? You don't get pregnant and all of a sudden decide you want to become a marathon Olympic champion, right? That's not normal. But if it's something that you're used to and you maintain on a regular basis, you're probably going to be fine, right? It's when it's not normal or consistent for you, then that can be bad for pregnancy. But for most people who've been exercising consistently, I think you'll find their doctors say, you're probably okay because you've been doing it for forever and a day. When you get to your third trimester, obviously, you might want to think twice about doing something that maybe make it more uncomfortable.
Thank you. So I see a lot of women who are over 45 coming into the clinics because they want to have a child or children, never been pregnant, or, or had one child, most of the time never been pregnant and want to have a child, but they're now 45 and over. What's your take on that?
Well, at that age, it is extremely difficult to conceive with assisted reproductive technology. But not only is it difficult to conceive because you have poor quality eggs and fewer eggs, remember I showed you the machinery that holds the eggs where they divide and and then just pull apart and all that machinery, it breaks down with time and the body cannot adequately fix it. That's why you see the percentage of abnormal embryos steadily rises as a woman gets older, right? So at age, in your 20s, 30s, you might have about a 20-some percentage incidence of aneuploidy, right? When you're over 42-ish, you're almost at 100%, 90 to 100% abnormality rate, right? So it's just that you have a higher incidence of abnormal cells. And at that age, it's almost 100%. When you test the DNA, it's almost all abnormal. So that's the problem. It's one thing to get the egg. It's another thing for the egg to actually be normal and fertilized normally. So the problem is you just get such a high percentage of aneuploid or abnormal embryos. So at that point, their best chance of getting pregnant is to consider donor egg.
So, question, we have women in our culture who naturally get pregnant at 50. I've seen one, I think it was 60, 62, it was in the papers or something, but it was natural, not.
Yes, so.
And with vibrant, healthy babies.
True. And I think people come up to me and say, my aunt got pregnant at 48 and 49, and certainly we have patients who may spontaneously get pregnant on their own, right? But when you take the whole group as a whole, like if we as clinicians are trying to initiate that process, the success rate is probably in the order of 1% or less. So if you look at statistics and success rates, it just really plummets at that age. So if it works by nature and you get pregnant, wonderful, more power to you. But as far as technology getting you there, the success rate is so low. I know in parts of Europe, they have done things like, remember I told you that the machinery that moves those DNA around and powers the movement of the organelles inside the egg and in the embryo feeds off energy from the mitochondria. Your mitochondria is your ATP powerhouse. So as a woman gets older, the number of ATP you have in your mitochondria, it's lower. You don't have that burst of energy to move things around. So there are cases, I think in Europe, and I know in Ukraine they were doing it for a while, where they took the nucleus from a donor egg and they took the nucleus out, and they try to put the nucleus of a donor egg inside the cytoplasm of the mother, with the thought that there's some mitochondrial DNA might contribute something. It's not allowed in America, right? But I know there are parts of the world where they're looking at that. So you're trying to shortchange a process that continues with aging, right? And you're trying to shortchange that and move it back. It's very hard to. It's easier to A, freeze your eggs while you're young, B, supplement. If you know you're going to conceive, start supplementing and doing things to clean your body up so that when you attempt it, you're attempting with the healthiest eggs possible. I know a lot of women who have, thought about, oh yeah, you know what, I'll go freeze my eggs. I'm 40 or I'm 42, and they shell out a lot of money. And then 5 years down the road, they're 46, 47, and they thaw these eggs and it just really falls apart, right? The eggs are really just not that good. So that quality really matters, and it does go down with age. So I implore all women, all professional women too, all working mothers, all working men, if you think you want to have your own DNA in a child down the road, then you want to consider freezing your eggs right, by age 30, 32. If you suspect you have endometriosis, you might even want to consider freezing your eggs a lot earlier. Okay, so it's easy to deal with that than to try and reverse engineer an egg at age 48.
And you know, I know we're not talking about sperm today. Freezing the sperm too has become important.
Oh, absolutely. We do
can't
look
wait
at,
till we talk about
yes, the DNA fragmentation in the sperm, the same insult that affects the egg, we now show that affects the sperm. So if you have a high oxidative stress, these free radicals can also damage the sperm DNA. So the sperm fragmentation starts to increase with age. So a man at age 45 is less fertile than he was at age 35, right? And when you do conceive as you get older, the incidence of other things, autism, schizophrenia, starts to go up with fathers who conceive later. It's not 100%, right? Because then you'll say, well, my grandpa fathered, half the village or something like that. but if you look at population as a whole, then you see that it trends to increased abnormality. So now, yes, for men, and there's no, well, at least for men, if you're thinking about it, the perfect madam hasn't come along. Freeze your sperm whatever stage of life you are in. Freeze your sperm.
Thank you. Thank you. Auntie Tower, you have your hand raised now. Please unmute. Thank you.
Dr. Famuyiwa,
Yes, ma'am.
how long can you keep your egg when it is frozen? When
Indefinitely. Indefinitely, as long as you pay the storage people to keep them. If you start paying them, they'll chuck it.
And it will still be okay, and it will be viable whenever you need it.
Yes, it will.
Okay, thank you.
How expensive is it?
It's not that expensive, depending on where you do it. Anywhere from $6,900 to, depending on the clinic you go to, $1,500, and then you have to factor in the cost of medication. The cost is related to how well you respond. So if you freeze your eggs at a much younger age, like 30, 32, it'll be a lot cheaper than you at 37, 36, when you may need more medication. So do your homework, and not just looking at the cost, but also looking at the technique they use in freezing and how comfortable they are, and how easy is it for the same center to thaw those eggs, right? What is their thaw rate before you go? I know we have a wonderful embryologist from China who, I call her my embryo magician. She has an incredible thaw rate of over 95% and is highly skilled. So if you give her good eggs, you're going to come out with good eggs.
Yeah, so that rate, is it yearly? 1,500 to 6,900. Is it yearly or monthly?
Oh, no. We're not talking storage. Storage is cheap. Storage is, depending on where you store it, storage is anywhere from $50 to $100 a month. Some even store less because they store in batch. So storage is cheap, We charge $50 a month, but I don't keep it long term. If you want to go long term, we recommend that you transfer to some, I call it storage depots, that can hold it forever and a day. In hurricane, earthquake, fire, they have protections, and they don't charge that much.
Thank you. Dr. Wu, Dr. Bean, you had your hand raised before I ask my next question.
Yes, I got one question. I'm sorry to ask. You help your patient to keep the mitochondrial function. The mitochondria is more important, you say.
Well, to the extent that your mitochondria is where your ATPs are produced. ATPs are your, think of it as your nuclear power plant. that produce the voltage needed to send the electricity out to the rest of the cells. So if you deplete those, the power plant of the essential ingredient it needs, like the supplements we talked about, it will not be able to generate that burst of energy you need to start moving. So what happens is when you're supposed to move a chromosome to one end of the nucleus or the other, and you can't, one is going to lag behind, right? And so you might end up with more than you need in one spot or fewer than you need in one spot. So when you fertilize that egg, you're going to get an aneuploid embryo.
My question is, how do you help your patient to keep the good, the
How do I help to do what?
Have to keep the patient have the good mitochondria. How could increase the mitochondria?
So again, you know, all the things we've talked about, right?
Yeah.
Healthy
All the
lifestyle,
disease come.
diet, your supplements, your vitamins, all those things feed into the same thing, right?
Yeah, because mitochondria is mostly important for cancer also, for everything almost.
So in that wonderful,
for the aging.
the most important thing that disrupts your mitochondria is a high inflammatory state, right? Which is what we talked about. So if you have the appropriate antioxidants, you help to improve and help them.
Oh, okay. Thank you.
You're welcome.
So it's all of those things, the diet, the supplements, the
lifestyle.
Yeah.
Yes.
And you are absolutely right, Dr. Wu. Cancer also. We keep talking about that because there's so much going on now. And that's why, you know, it's very interesting that it doesn't matter what speaker has come on this forum, they talk about what we put in our bodies.
Correct.
It's very important that we start paying attention and to start reading labels to know what's in those things, because things are, you know, camouflaged sometimes if you don't read the labels. So I have a question. This is a real life person. I can't remember if you even know this one. No, you don't. Well, maybe you do. So I had a patient who was, I think, 48 and wanted to, you know, have assisted, you know, no, did not want to use donor egg.
Correct.
So I sent her for MRI, and radiologist said she's fantastic. Her eggs look fantastic, but she was refused the ability to even harvest the eggs.
Did you mean the ovaries?
No.
So probably, you know, what are they talking about? They saw antral follicles. Is that what they define as okay? Because it's not the same.
But the thing is, what the question, what I didn't understand is that this person is willing to pay the money, is willing to take a chances on the eggs. We have ability now to actually look at the egg and decide, okay, this is good for implantation.
So yeah, well, okay, so that has a lot of things tied to it. You know, I have seen patients who I've tried in the past to stimulate them. I had a 46-year-old that I stimulated, like 22 eggs from her. And I was like, oh, wow, you know what? Well, whoop-de-doo, you know, we got this many eggs. Well, that's just quantity, not quality. I mean, the legs were literally falling apart on the Petri dish right in front of you. So the eggs may be there, but they're not competent. And when you try to fertilize them, they fall apart. So, you know, and then you have to understand there's something in medicine where you have to be very, very careful. If she has her money, she will eventually get someone who will stimulate her, right? Her chances of getting pregnant is essentially like 1% or less, right? So I think that in the medical community, we owe our patients the responsibility to say your chances are this low, right? Why would you want to give me money for it? And if you want to give me money, put it in a brown paper bag and give it to me at Christmas and let me know you're giving me a Christmas gift. But for me to take that money, knowing the statistics, I think I'm doing the patient a disservice, right? You have to be honest with it. I've seen patients who come to see me and they bring their records and I look at it and I go, gee whiz, I could have told you that it wouldn't work, based on what I'm seeing. Why did you go through it? So the way I look at it is, look, what I tell my patients, when you have a pile of money and you say, okay, I want to conceive with this pile of money, you want to pull that pile on what's going to give you the highest success rate. Now, that may very well mean that you put that pile towards exploring resources for adopting, right? I mean, that way is 100% success because you know what you're getting before you put your money down. But if you put, if you're stimulating someone in their older age and they pay 20, 25,000 for something that might yield a less than 1% success rate versus putting that 25,000 or whatever it is towards a donor egg. Now they may need more depending on what they do, but has a success rate of 70%. Where would you put your money? I had a patient once where I had to convince the husband to stop. And she was 45 and, oh gosh, please, 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 I just really need to do this. And, and the husband said, well, and I think she was 44. And the husband said, well, you know what, I love my wife so much and, I'm willing to pay. The first cycle got eggs, but they were really bad. This was even before the day of PGT where you could test the embryo. And I told them, look, your egg quality is really bad. You would have a high chance with donor egg, right? But, oh, please, I'd really love to. And I found out they were mortgaging their house to do this with a very low success rate. So I told the husband, I said, look, let me ask you a question. If you had a child that saw a bonfire and says, Daddy, I really, really just want to jump into that fire, just real quick, just for 2 seconds, would you really let them? If you love that child, wouldn't you say, well, I don't think that's a good idea, and actively say, well, why don't we go pursue something that has a better chance? Yes, there are clinics out there trying to do ovarian rejuvenation, and I've had patients come to see me and they've done, I wouldn't even mention names of things that they've done, right? But the outcome is still poor. And at the end of the day, they still need donor eggs. Now, if they conceive, you'll be hard pressed to say it was because of whatever was done, right? Maybe just got like the woman we talked about and she got pregnant on her own. But at the end of the day, and there have been studies on this, there have been reports from the American Society of Reproductive Medicine, that at the end of the day, the reproductive endocrinology world has a responsibility to these women to not give false hope. Like when I tell someone your chance is really very low, they don't hear that. What they hear instead is, oh gosh, that means I have a 1% chance and maybe I'm the 1%. You know what I mean? So they don't hear what you're saying. And people have gone bankrupt trying to do things that have a low yield. Now if you have, maybe your uncle owns, Google or something like that, and you can pour money on it, you can try whatever you want. And then if you sink 50,000, I know personally, a patient of mine who had been through like probably 6 or 7 different shops around town. And when I add up how much money she spent in all those shops, I mean, easily, I'm sure she spent over 500,000. I mean, she had the funds. She was well off. But regardless of that, she's still pouring money, and people were helping separate her from her money. And she still, I think she ended up adopting, right? So she has a child now that's just a sweet child. You wouldn't even know unless I told you she was adopted. So there is a time where we need to sit down with our patients and be honest with them, you know, and be honest.
I agree. Thank you. You know what? I love the fact that in medicine, we do realize that there is 1%, 3%. Seriously, that's what contraceptive failure rate, 0.3%. It's not even 1%, 0.3%, right? And people get pregnant.
Correct.
On contraceptive pill, on that 0.3%. We know our limitations. I appreciate, you know, your outlook, and it's very important. I praise God for this country, America. In America, the truth is told to patients. All of my patients, 100%, will come to me that the fertility doctor said, I have 1%, 2%, but at the end of the day, it is still their choice. And yes, they may end up being that 1%. I'll always remember that oral contraceptive percentage. I remember when I was in residency.
I agree with you, and I hear what you're saying.
No, you know what? I wanted to say something. When I was in residency, I participated in a bilateral tubal ligation where we cut and burnt the tube. I was a tied one. I assisted in this surgery.
And she got pregnant.
And she got pregnant.
Right, because sometimes you can overdo it.
What happened? Did the egg?
Well, you have a tube that
you wanted to sue.
Well, look, you cut it and you burnt it, and you damaged the ability of the tissue to heal properly. So you can form a fistula where that lumen was.
No, but we cut it, and we burnt that end. We burnt one end there, and we burnt the other end there.
And those are the ones that can fail the most, again, because you decrease the ability of that tissue to heal when you burn it that way.
We burnt it, and then we tried it. This was years ago. This was, you know, this was years ago.
They don't do this anymore, but the highest rate is they put a band around it, right? Not just cut it, you put a band around it, it can erode, or you bury one end of the tube in the uterus, right? But you can't form a fistula. If you overdo it, if you burn tissue, it doesn't heal well.
Yeah.
So if you overburn the tube, you may actually not be doing anything.
Okay, that's my point. At that time, that was what we thought was the best to do. That was how it was done. And we thought the chances of you getting pregnant is nil. She got pregnant. And when she said she was going to, I was the resident who she, you know, met at the clinicals, and I sat there and I'm like, you know what? I was at your surgery. We cut, we burn. Tell me we are not God.
Correct.
God is God. A fistula formed, the egg jumped, whatever happened, she got pregnant, despite us. Now we have better procedures. It doesn't matter what procedure, you know. That's my point exactly.
Correct.
That in medicine, we have knowledge that God gives to us little by little through research, and we continue to evolve. It's only the word of God that doesn't change. I love medicine.
And you know, stay tuned. It may be in the future that they're able to correct all these damages that you see in the egg.
Exactly.
And maybe 20 years from now, such an egg may become once again rejuvenated and is now completely competent.
Exactly. See, you got my point. And not because now we can choose if the egg implanted is a male or a female.
The embryo.
The embryo.
Correct.
Pardon me. If the embryo is a male or a female, you can actually decide your sex. So we've evolved, and God knows. You're right. You know, we will keep staying tuned. Sister Hilda, you have your hand raised. Sorry, Dr. Famuyiwa and I are having fun. I didn't forget you.
Yes. We are also enjoying it. I'm so sorry, I can't put my video back on because of where I am.
You're okay. You're okay.
Thank you so much, Doctor. I watched one of your programs on YouTube. So when I saw that you were coming, and I said, oh, maybe she's going to repeat exactly the same, but I'm so happy that this is completely different from what I watched on YouTube. So I am really I'm learning a lot, and I'm so excited to listen to you. But my question is about the donor egg. How does it work exactly? And is there any impact on the DNA of the couple if they get a donor egg from someone, if they use someone else's egg, please?
So when you have a donor egg, and you have the eggs coming from a young person, the quality of that egg is good. So the chances of getting pregnant using donor egg is much higher because you're using eggs from someone younger. So you're looking at the age of the egg, right? So if the age of the egg is, if the genetic age of the egg is young, then the chance of getting pregnant is much higher, right? So that's why you see women who, we know that the success rate for pregnancy goes down with age, right? But if you have donor egg, that success rate goes back and reverts to the age of the egg, right? So you have the age of the egg is what is more important.
Did that answer your question? That the age of the egg is what is important. I think she was asking about the DNA of the partners, how it comes into play. It's because this egg is not from the woman. It's from somebody else.
Right.
Correct.
Somebody else who is younger,
Right.
whose egg is healthy.
Right.
And vibrant. Actually, there's a process to that. They get to read about the donor.
Correct.
Who they are, how old they are, their educational level,
Correct.
their height, color, creed, stuff like that, achievements and all. They get to do that for the sperm donors too. So
Yes.
I guess she's wanting to know, does the DNA of the woman somehow then intertwine somewhere with the egg? No, go ahead.
Yeah, that's correct. So how does what is the process of the donor egg? So you take the egg and then you implant it in the woman, and then is there any, I have never done one. I don't know exactly
so
how.
You take the egg from this person that donated it and fertilize it with the sperm of usually the male sperm, the partner. So a question is, how does the DNA of the woman receiving the egg and the sperm that is used to fertilize it, how does their DNA work with the donor egg?
So as long as the embryo is healthy, the embryo has a very good chance of implanting, right? So the only thing you might worry about is if you have blood type incompatibility, because you might get you have to look at the blood type, for instance, of the mother versus the sperm. But having said that,
I think the question is still, okay, I'm gonna venture to just answer that. The DNA of the donor is what would mix with the DNA of the sperm giver.
Correct. Correct.
The woman receiving DNA will not be part of that process. She's going to be the carrier.
Correct.
And that's her baby.
Correct.
But her DNA is not going to be part of the process.
Correct.
Does that answer your question, Sister?
Yes. Yes, that's perfect. Yeah.
Okay. Yeah. Sorry, I tried to phrase it, but that's really what she wanted to know. the DNA of the woman receiving. Yeah, Dr. Jagbe, go ahead, sir.
Yeah, I was about to ask about the compatibility, tissue compatibility, not necessarily blood compatibility, because
yeah, I mean, for people who are not conceiving or have recurrent miscarriages, there is something, and then that's you're talking about the very, very low percentage of patients now who may have what's called HLA incompatibility.
right, that's what I was trying to allude to.
So you can look at HLA compatibility and test for it. That would not apply to the vast majority of patients. That would be a very low percentage of patients where you need to go to that extent.
Okay, so there hasn't been tissue rejection as you know, after the implantation and all of that.
So we don't really see that much when you're doing donor eggs. So tissue resection that you're talking about will be in patients who have recurrent pregnancy losses, but not in egg donors per se.
Okay. Thank you.
Okay.
Thank you so much. There's a question from Ayat Abe that I would like, Ayat Abe, I'd like you to please unmute and ask that question about human rate of decay slowing down, you know, human corpse. I didn't understand that question, so I don't know how to ask Dr. Famuyiwa. I'm asking you to please unmute. Thank you.
Good evening, everyone. Well, this was in reference to the consumption of residues of plastics and other things that we may consume. And so I just sort of related it to, I think in the past there was mention of the human body is decaying, the corpse of a human person is decaying slower than it used to be due to whether it was plastics or plastic surgery. But I was just wondering if this is related to that as well.
Plastic surgery versus plastics in your system?
Both, not versus.
I don't think so. I think that's
Contributing.
related. Plastic surgery is different. Plastic surgery just refers to the manipulation of the body, either with a knife. It's not, doesn't mean you have plastic when you have plastic surgery.
Well, I guess I should say the addition of what do you call them? What is that you use for fillers in the body? You know, in addition to maybe plastic consumption in food. I was just trying to brainstorm and think, you know, because I had heard in the past there was mention of the rate of human corpse as far as decaying is slower than it used to be. I heard that somewhere years ago. So
you know what? Just a thought. I am clueless at what you said. I don't know if it's true, if the rate of corpse of human body, if the rate of decay has slowed down or not. But just a thought that because of all the preservatives in things that are eaten, you can buy an apple and that apple should have rotted after a few days or a week, where you have it there for 3 weeks, 4 weeks, and it's still looking fresh. Like what's in it? You know, I wonder if, you know, like Dr. Famuyiwa mentioned, that there is testing now that can test the plastics in your body, you know, those toxins in your body, you know, they're there. So when somebody dies, since they're there, could preserve the body longer. Because the preservatives, just a thought, I don't know.
that was just a thought.
Are there. That's a thought. What do you think, Dr. Famuyiwa? I have no idea.
You're talking about, I don't know if we're going off a tangent here, but I don't know. You're talking about the preservative they put in.
No, the plastics, that the phthalates,
Yeah,
that you talked about. That was when she asked the question.
We do know that the phthalates are higher in patients who have incidence of infertility, and also tend to be higher in patients who have recurrent pregnancy losses. So clearly associated with miscarriages, clearly associated with egg quality. So especially in excessive levels.
So this was just off topic, but I thought I'd mention it. Thank you.
Thank you. It's not a territory that I think any of us are really experts in.
No worries.
I think that's more of environmental medicine.
So, but stay tuned, because we may bring somebody sometime who can, shed more light into that for us. There's a question that says, at what age should a patient opt for donor eggs?
It's not so much at what age, it depends on the egg quality and if they have any eggs at all. Like some patients may have poor egg quality, or they have patients who have decreased numbers of eggs. So if you have poorly functional eggs or quantity, then you may need a donor egg at that time.
So a follow-up question is, will you have to have some tests done to know the quality of your eggs?
So quality, you cannot really estimate per se. You can estimate quantity, right, by the anti-Mullerian hormone level, because it's associated with the lower the AMH level, the lower the amount of eggs that you will get. But it's not necessarily related to quality. Quality you can never really get to, right? I mean, yes, if someone is older, you know that they have poor quality eggs, you can try to grade them and stuff, but you might also get poor quality eggs in patients who have extensive endometriosis, where, especially if they've required surgery on their uterus, where parts of the uterus have been pulled out while they're removing they're removing the endometrioma sac. So those patients will have very, very poor quality. So if you just don't have any functional eggs, so it has nothing to do with age. Someone who's, had surgery or any kind of thing that have compromised their ovary may need donor eggs, right? There's some, yes, there's some patients, usually you think of patients in their 40s that need donor eggs, right? But there are some patients who have premature ovarian, we call it premature ovarian insufficiency, right? And that can happen at any younger age. And those patients will require donor egg.
So the egg quality, you don't know until it's time to maybe
Exactly.
the egg. And
exactly.
Dr. Famuyiwa said it over and over again, then that you see the eggs just falling apart.
Yeah.
She talked about the woman who had 22 eggs harvested.
Exactly.
And you're like, yes, but then it was time to fertilize and everything was just falling apart.
Right.
So that's when you know if the egg is qualitative or not.
Yeah.
So, Auntie Tower, you have your hand raised.
Yes, please. Will those people that have breast implants, will the breast implant affect their taking in, having their pregnancy carry up to term because of the palate or whatever, the plastic that is in breast implant? That is number one. Then you said, the second one is you mentioned premature ovarian problem, cyst. Is that reversible?
No, it's not. It's not.
Why do you say no? Because I was diagnosed with that and I have children. I don't know what happened.
And you were,
What were you diagnosed with?
yeah.
Ovarian cyst, premature
No,
ovarian.
sis, it's
But
not,
that's not what she said. That's not what she was talking. Sorry, go ahead.
What was she talking?
not a cyst. We're not talking about cyst. Ovarian insufficiency is not the same as a cyst.
Okay.
No, I think when you mentioned the endometrioma, endometriosis and the endometrioma cyst, I think that's what you probably heard. When you were talking about the surgery to remove endometriosis.
Right. I'm just saying anything I don't think there's a set age where you say this is an age that you have to use donor egg, right? It's not, any number of things can compromise the ovary.
So ovarian cyst is a cyst on the ovary, just what he said.
So a cyst is different. We're not, I wasn't talking about a regular old cyst. I was talking about endometriosis. That's different.
Yeah.
So ovarian, the ovaries not being able to do the work they're supposed to do is different from the ovary just having a cyst on it.
Yes, exactly.
So I just wanted to break it down.
Yes.
So having a cyst, people have cysts that don't hurt, or it could be painful.
Yeah. Cyst just simply means fluid filled,
yes.
Right? Then you got to quantify it. What kind of cyst? Hemorrhagic cyst, endometriotic cyst, complex cyst. Cyst is just a generic term. Is it a follicular cyst? Is it a corpus luteum cyst? Cyst means fluid filled. Then the characterization of exactly what kind differs. So the kind I'm talking about is a kind that actually is depletes and affects the eggs left in the ovaries in a negative manner.
Okay, thank you. But what about the implants?
That question, she said the breasts, people who have breast implants.
I mean, I don't know that, other than to say, okay, they're probably exposed to the same things we've talked about, right? Phthalates and BPA and whatever it else isn't. But most, there are some breast implants that are simply saline nowadays. So they're not like the old days when they used to inject the chemicals in them that swells and everything. I mean, yes, it's still in the plastic, if you will, and that may leach phthalates, but if it's saline based, I don't know, or I'm not aware of studies that have said, okay, this one is going to cause more phthalates. There are a lot of things that people put in their body that may be worse, and also you have to look at lotions, because your skin has a wider surface area, right? And so what are you lathering up with every day? What exactly is in it? So you want to look at those products as well.
That's an excellent point. The skin is huge.
Dr. Famuyiwa, can you say something about PID or generalized infection that affects the pelvic cavity?
So the mechanism of that, again, is inflammation. PID is pelvic inflammatory disease, right? Can be caused by chlamydia, by gonorrhea. You have a tubal ovarian abscess that is very inflammatory, and you have thick masses of pus in your tummy. You're going to have inflammatory products that a lot of times it destroys the tubes, mostly blocks the tubes. So that is something that hopefully should be appropriately treated before women try to get pregnant.
Yeah, I was just alluding to the fact that the complications afterwards,
right,
of
exactly,
the ovary and whatever else surrounding the tissues there. That's what.
Right, because of the inflammation and all the pus and everything that can go on. It can be somebody. Sometimes I describe it to patients as, think of somebody pouring crazy glue into your tummy, and you get the adhesions really do.
Exactly.
They look like somebody poured crazy glue, and people sometimes get what is called a frozen pelvis from that.
Right. So that was what I was trying to allude to in terms of scarring that takes place there.
Correct.
Yeah.
Well, I don't know about The rest of you, I have learned so much tonight. Thank you so much.
Thank you.
Dr.
Thank you.
Famuyiwa. You know, what is amazing is the delivery, what you gave us in a nutshell, and in the Q&A is invaluable. And the way that it was presented for us to understand, we appreciate. Thank you so much.
Thank you.
Thank you. And this is a very, very important subject. There are so many young ones today that have problems of infertility. Freeze your eggs, freeze your sperm, do it early. I think it's one of my take-home messages. Watch things you put in your body, those phthalates, and, you know, supplement.
Excessive alcohol. That's a whole different topic right there, right? Not good. There's no vitamin in alcohol.
There isn't. Thank you for bringing that up. There isn't, and that is the truth. So we really need to have lifestyle changes, you know, because what we put in our body impacts every organ, every area. So I'm going to yield back to you, Dr. Famuyiwa.
Thank you so much. It's been a pleasant night. And I really do like, you guys are such a nice audience. It's a very sympathetic audience. It's easy to shine. Thank you so much. I look forward to our next talk. I love it. I learned myself from different forums that you've had. And I tell my patients to listen in, and even my staff. I know my office manager is one of your regulars, actually. So, but thank you so much. I really am very honored and humbled that you allow me to come speak. Thank you.
Thank you.
When are you coming back?
Oh, so that will be between Dr. O and I. See, you have to, I have a difficulty just talking without showing what I'm talking about. So that means I have to prepare slides. And that's the part that sometimes takes me a little while to get but it's getting easier, because my topic really just talks about the same thing. Maybe I might expound on a different aspect at another time, but I'm really still talking about the same thing. I find the science, the biology of reproduction, to me, is fascinating. So you don't want to get me started. I might bore you to tears.
No, your area of medicine is not boring at all. And, you know, it's very understandable why you need slides for your specialty, because it's a visual thing. If we don't see, then it doesn't really hit home. Yeah. You know, when you show those slides, it helps us see, okay, this is what I'm looking at. This is where it is. So we thank you for the time you put in. We thank you because you do try to make it once a month, even though sometimes we stretch it a little bit. So we really appreciate you. Thank you.
Thank you.
I want to also note that, you know, we don't establish patient or physician-patient interaction on this forum. We give information, advice, and if you want to consult with Dr. Famuyiwa, please get in touch with me by email, or Dr. Famuyiwa, if you can post your information.
Oh, absolutely.
On there, please. Get in touch whichever way. If you have my cell phone number, get in touch with me. I'll always respond. By email, I will respond. By text message, I will. And you can contact her. She is one of our best. I know people personally who have successfully have multiples in our practice, you know, and she's a gift to us.
Thank you. If you go to my website, there's a little box, you type in a message there, we will get back to you.
Fantastic.
Thank you so much, Dr. O. Thank you.
Thank you.